Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 29th of September 2021. In terms of COVID positive inpatients, that's patients who are positive within 14 days of their first test. The number's pretty much the same as last week actually. We've got 39 showing today with 4 patients in critical care, 34 on our general beds and 1 patient in Clifton. We've also got about 19 other patients who are here because of COVID but are more than 14 days since the first positive. So that fits with the community numbers a little bit, which for Blackpool, Fylde and Wyre are all in the mid 400s per 100,000. Have come down a little bit for Blackpool, gone up a little bit for Fylde and Wyre. Within those numbers, the biggest population group who are showing positive are really school-aged children between 10 and 19, and I think that's a reflection, of course, of children going back to school. The numbers for the over 60s have happily come down a little bit, so that's a piece of good news, I think. We've had 7 additional deaths, that's deaths within 28 days of first positive test, recorded in the last week, which is up a little bit on previous weeks, and so condolences to friends, family, loved ones of all involved. I suppose the story still really is about vaccination, and of course children in the 12 to 15 age group, the schools began their programme earlier on in September, and I understand that's going very well. From a purely hospital medical perspective, we still remain very anxious to see that pregnant women are vaccinated, and there's ongoing data which shows that's a very safe thing to do, but also we've seen some people really poorly, some pregnant ladies really poorly with COVID, so we do think that's very important, and of course flu jab for pregnant ladies as well. Boosters. Now, COVID boosters are now available to all health and social care staff, and they, if they haven't been contacted already, can go online on the NHS UK website, or in our case through the Trust site, to arrange an appointment. So we're all well on doing COVID boosters. Any adult over the age of 50 and anyone over the age of 16 with the, if you like, the usual list of health conditions will get notification from NHSE, and then we'll be able to go and book a COVID booster. So that's going to happen progressively really from now on, so look out for those prompts. Flu jabs, of course, we're well underway with those, and so if you've had an appointment through for a flu jab, please do take that up. And to clarify, it is perfectly okay to have a flu jab and a COVID booster at the same time. I would suggest in separate arms, but it's fine to have the two together. So the more we can crack on with that joint program, the better, I think. I've mentioned before that our visiting arrangements have eased a bit, but that doesn't mean they're back to completely pre-COVID normality. Anybody coming on site, of course, we will ask at the front desk to put a mask on and to abide by our own infection prevention and control rules. So thank you to everyone for complying with that. It feels a little bit odd that they're so different in hospital to elsewhere, but I'm sure people understand the reasons for that. There's some national publicity around changes to infection prevention and control guidance for hospitals, which has come from the UK Health Security Agency, the UK HSA, and that really is for patients who are waiting for planned procedures. And whereas before we might have been asking people to self-isolate for 3 days and to do a PCR swab and so forth, when that guidance is signed off, which I'm sure I will be able to report this time next week, we will be looking at no need to do those things, but to have a lateral flow test when coming in for the procedure. But that hasn't been signed off yet, so that's just to give you the heads up of what's going on and coming through the national the national media. So perhaps finally, as ever really, I'm afraid to say our emergency department and all the emergency services are extraordinarily busy. We know that the ambulance service is extraordinarily busy, our ED is, our GP walk-in centres are, and I think they're being used by people who need to be there by and large. So really what I have to say is please be thoughtful about which of the services you access if you feel you need urgent or emergency help, and there's clear guidance that comes through the NHS 111 programme as to which is the best service to pick for your needs. And then finally, the same infection prevention and control measures still persist. So at an individual level, the hands, face, space guidance is still clear. Useful, good evidence actually to support having ventilation indoor spaces. If you're meeting with people, if you can keep the air flowing, that's a good idea. So thank you as ever. I'll update you again next week.